Hello, my name is Dr. Michael Darson. I'm a urologist at Arizona Urology Specialist in Scottsdale, Arizona. First, the prostate overview. The prostate is a walnut-sized gland at the base of the male bladder. It surrounds the urethra. It produces fluid that transports sperm during ejaculation. The prostate grows to its normal adult size in a man's early 20s. It begins to grow again during the mid-40s in most men. What can happen to the prostate? Each condition affects the prostate differently. Enlarged prostate, or BPH, benign prostatic hyperplasia. Number 2, prostatitis, which is inflammation of the prostate. Or number 3, prostate cancer. Now let's do a BPH overview. What is BPH? Commonly known as enlarged prostate, BPH means the prostate gland has grown larger than normal. The normal adult size is approximately 1.5 inches in diameter. BPH can lead to bladder outlet obstruction that can cause lower urinary tract symptoms. Does BPH mean that I have prostate cancer? The answer to that is no. BPH is not prostate cancer. BPH does not cause prostate cancer. BPH may coexist with prostate cancer. PSA alone does not distinguish BPH from prostate cancer. Both BPH and prostate cancer can have elevated PSA levels. Normal versus enlarged prostates. As the prostate enlarges, pressure can be put on the urethra, causing lower urinary tract symptoms. Prostate size alone does not correlate with the degree of obstructive symptoms or the severity, and it's important to understand that you can have a 30-gram prostate, which is normal size, or a 100-gram prostate, and they be equally symptomatic. What are the symptoms of BPH? Frequent urination, and you may experience that both day and nighttime. You may have the sudden urge to urinate. You may occasionally have burning with urination. You may experience weak flow. You may have the sensation that after you've urinated that your bladder is not empty. You may have trouble starting and stopping your urine flow, and you may ultimately develop the inability to urinate. BPH can affect quality of life. Many men who suffer from BPH may experience a reduction in their quality of life. Up to 95% of men with moderate symptoms are unhappy and don't want to spend the rest of their lives with these symptoms. 51% of men say BPH interferes with an aspect of their normal life. Studies show 49% of men experience sexual problems associated with lower urinary tract symptoms. BPH also can affect a man's partner, their quality of life, their daily routine, and even their relationships. Who can get BPH? BPH is the most common prostate problem for men over the age of 50. BPH affects 50% of men by age 60. BPH affects 90% of men by age 85. In 2010, as many as 14 million men had lower urinary tract symptoms. Obesity, higher body mass index, and lack of exercise may increase the risk of BPH. How is BPH diagnosed? A medical history and physical exam are performed. Prostate exams are done with a digital rectal exam. Urinary output testing helps us figure out peak flow and post-void residuals. Self-evaluation of symptoms is also performed. There are validated questionnaires such as the American Urologic Association Symptom Index, the International Prostate Symptom Score, Quality of Life questions, and Bladder Impact Index.